Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. And today with me, I have Joe Ulrey and Carolyn Miller. They'll be assisting us today. Either of you guys want to say anything to introduce yourselves?
Yeah, hi, I'm Joe Ulrey. I just started with UMTRC earlier this year, part of the UMTRC COVID grant, and we'll be getting into it a little bit later, but my main focus is on developing patient resources, and you guys will be seeing some of those a little bit later.
Carolyn?
I just started as well. My name is Carolyn Miller. I just started as the new administrative assistant with UMTRC.
Thanks, guys. Kelsey, would you like to introduce yourself?
Sure, I can do that. My name is Kelsey Frazier. I actually work for the PCA in Michigan. And so I'm actually I was just kind of joining to see kind of what was said and if there was anything new to pick up on. If I'm the only one on this call right now, I'm happy to kind of just let you guys chat about whatever it is. I don't have any specific questions. I think I have a pretty good background as far as understanding that our telehealth allowances right now. As an FQHC, we kind of handle things obviously a little different than regular office, but other than that, I'm kind of just here to hang out and listen.
All right, fair enough. All right, so with the Upper Midwest Telehealth Resource Center, we cover the 4 states of Illinois, Indiana, Michigan, and Ohio. We're one of 12 regional telehealth resource centers around the country, and then we have 2 national centers, one for technology and one for policy, and we'll share some information later on the technology telehealth resource center. So today, really, we just want to showcase what Joe has been able to do. We had some extra funding from the CARES Act, and we've started making a lot more infographics and handouts around patients and provider resources. And I think probably Joe will show us some of the information. We've just seen a huge increase with COVID-19 over the number of visits that are being done via telehealth. So at this point, I'm just going to turn things over to you, Joe.
Yeah, so I'll go ahead and share my screen and pull some of these up. And really, it's designed to help give patients an introduction or just more information on what telehealth is and what it can do for them. And so this was the very first one that I put together, and it was just to give patients a general feel for what telehealth was and different terminology, because in something that's very new to people, just with any topic, there are a lot of different terms and stuff that can be unfamiliar and confusing when people start throwing them all around. And so this was just designed to start letting people know what it is, who it's for, and a really important question is how people can gain access to it. A lot of people may even know about it, but may not know how to, access it and utilize those resources. And so one of the first things that's recommended is to just talk to your main healthcare provider, your primary care physician. Oftentimes they will know resources for you to find, or they themselves may provide it and can help give you that information. But these two, if you go to the UMTRC website and pull up this resource, these two resources down here, these are links out to ways for patients to identify different ways to gain access to that healthcare. So if we'll just click on one of them, it's just a healthcare directory. So you can look specifically whether you're a patient or clinician and identify what type of services you're looking for. And this can help you find different access in specific areas for you. Let's see. Sorry, the toolbar keeps coming down on my ads. But yes, so those are two very good resources specifically for patients to identify. And then also just wanting to help patients gain a better understanding of what telehealth is. I accumulated a lot of data points and put those together to show the utilization of telehealth, and specifically with Medicare users, as this was the largest increase patient population in usage of telehealth, as shown by this graphic here, is that in the weeks prior to COVID-19 and once COVID-19 went into full effect and we entered the public health emergency, the usage just skyrocketed for Medicaid users. And so we're still just working on trying to figure out what we want to focus on for patients. And so this is just another general guideline of what to expect with the telemedicine appointment. And this can vary just depending on whether your telemedicine appointment is from your home or whether you're going to a health center location and receiving your appointment through there. And so we also have this telehealth workflow. And like I said, this will vary for patients depending on the practice, the hospital, and whether you're receiving on-site telehealth care or whether you're receiving your care from your home. And we have many more resources that we worked on creating, and I have a couple others, and I'm working on resources for specific specialties. Right now I have one for telebehavioral health, but just because every specialty will provide care in different ways, whereas some require more equipment and quote more hands-on, even though it's via telehealth, compared to whereas like some telemental health and telebehavioral health, those are require less equipment and more talking and care that way. But really what we wanted to do is obviously create more awareness and have these resources with this increased patient population looking to telehealth. And I'm still trying to gauge what information is most needed by patients. So whether patients are coming to us with questions or people as providers are receiving questions, any information that can be given to me or UMTRC to help us focus in on certain topics and what patients are most looking for and most lacking information would be really great to just help us better target what the patients are needing. And regarding equipment, as that is a common question that patients do have, I'm going to hand that back over to Becky as she has a little bit more information regarding that and the specific tools that patients would need.
Oops, if I unmute myself. And Debbie, would you like to introduce yourself since we've got a small group here today? We're pretty informal. I can't hear you.
Hi, sorry.
Oh, there you go.
Now can you hear me? Okay.
Yes.
Hi, I'm Debbie Rosansky with Medical Advantage Group. I work with the physician organization SIPA. We've got, what, 600 to 800 providers within the organization.
Mm-hmm.
And we've been using, for the FQHC training, we've been using your organization all year.
Yes,
So I
I've
appreciate
talked to a
your
lot
help.
of folks at Medical Advantage Group. Thank you.
Yeah, it's been a great help.
Good, good. And we've got Juan I hope I don't butcher your last name, Pacheco. Is that correct?
Pacheco, yes.
Welcome, welcome. Well, I'm going to share some information about technology, and then since we have a small group today, really just kind of use the information and the topic of telehealth. You tell us what information you'd like as far as patient resources, as provider resources, and we've got another virtual office hours really next week. I think it's next week that we're going to focus on provider resources. So today we're really focused on patient resources. What can we do? Joe has shown some examples of what he has created over the past couple of months, and really we're here to help you. So when it comes to technology, I'm going to go ahead and share my screen. One of the 14 telehealth resources centers around the country is our National Technology Center. They're based out of Anchorage, Alaska, and they're constantly updating their toolkits. So depending upon what type of telehealth service you want to provide, they've probably got a toolkit for you. So a lot of questions we get about video platforms, and especially last spring when telehealth was so new to many folks, they didn't know how to do telehealth, what kind of a platform they needed to invest in. And currently we are still under the public health emergency, so you can use things that are not HIPAA compliant right now, but we do not suggest that. Telehealth is not going away. It is going to continue to stay around. The public health emergency has already been extended by the feds through the end of January of 2021. And we may see a lot of those barriers and the waivers that allowed patients to be at home and to be at any location. We may see them go, to the end of 2021 and even further. There's a lot of pressure on both state Medicaid groups and on Medicare at the federal level to continue to allow patients to be at home. And this brings a lot of opportunity as well as some challenges to be able to accomplish that. So they've looked, the National Technology Resource Center, or TTAC as we call them, has done a really good job of looking at all kinds of different video conferencing platforms. And you can see things about cameras, direct to consumer is a hot area, stethoscopes, home telehealth, mHealth apps, blood pressure, exam cameras, more for like dermatology or wound care, all of these things. So depending, for example, if you're just going to do behavioral health, all you need is a secure HIPAA compliant platform that's audio visual, kind of like what we're using today. And if you are doing chronic care management, then you might want to look at more direct to consumer or home telehealth items. But I'll go ahead and I'll copy this link and put it in the chat so you guys have that. All right, so what questions do you guys have for us today? What were you hoping to get out of today's session?
One of the biggest problems we have when different organizations ask for assistance in establishing telehealth, the patients, like you said, have to invest in certain equipment. They understand that they have a camera, but the Google platform is free. But is it HIPAA compliant? And what other platforms are available if the patient does not have access to Microsoft Office, even though Office has a free version, Office 365. Okay, so what should we don't want to recommend one, but we would like to know if there's a list available they can download or something they can look at.
Yeah, so that right now, well, okay, so let's go back. Google, and are you talking about Google Hangouts or Microsoft Teams?
We're Google Meet and Microsoft Teams.
Okay.
I know Teams is free, but most of the patients are not familiar with that unless they come from an office background or environment.
Right. I don't know off the top of my hand if Google Meet is HIPAA compliant. One of the ways that you can tell as a provider is if they are willing to sign a BAA, a business associate agreement with you, then they are probably HIPAA compliant. I'm looking at Google Meets right now. So we're using Zoom today. There's a HIPAA compliant version of Zoom. I know a lot of, depending on what electronic health records you're using, Epic and, shoot, I lost it. It's either Allscripts or eClinicalWorks. Both have video conferencing platforms built into the electronic health system. I know a lot of folks are using DoxyMe. And there's another one that's really similar to DoxyMe called, oh, it's escaping me at the moment. But I would look at, use that link that I put in the chat and go out to that, our National Telehealth Technology Group and look at all of the different platforms that they have reviewed and see what will work for your situation. Other questions?
Thank you.
You're welcome.
I don't know if it's really a question, but barriers from the patient side, broadband seems to be kind of a big issue.
Mm-hmm.
I don't know if you have any suggestions for.
Sure, and we're following that in all states, and $50 million seems to be the round number. Over the summer in Ohio, the governor there put $50 million into a focus on schools and access through schools and mobile devices. Indiana just made awards for additional contracts with or funding to local telecommunications providers to build more fiber out to residential areas. Michigan has done something very similar over the last several months, and Illinois has had a focus on broadband expansion for the last couple of years. So I think that's going to get better. I hope that's going to get better. And it's going to take time and investment. I do know some people that I can share my screen, and if you have patients that are on any type of federal assistance, let me get my screen back up again. There is a program called Lifeline. I don't know if you've heard of it. It is a federal program. And if an individual is on food stamps, so SNAP or WIC or even Social Security, they can get either access to low-cost broadband internet for their home, or low-cost phone service, or a low-cost mobile cellular service. So here's the link. I'll put this in the chat as well. So that's something to help them to make it more affordable. Now, it becomes more difficult if they don't have adequate internet access in their area. There's all kinds of opportunities for satellite internet, but those can get expensive. My cell phone service is for Verizon, and with an individual, it's like $100 a month to get a hotspot to carry around with you. But I do know, and we've gotten a lot of questions from state Medicaid departments in our region, kind of looking into, as an insurance company, do we provide stuff to the consumers so that they are more digitally sound or secure in their own homes? It's a huge topic of discussion. I don't know if any of that helps.
Yeah, I appreciate that. Thanks, Becky.
other thoughts or questions today? Joe, did you want to put up a link to any of the resources that you shared early on? Oh, yeah, I got a comment. Oh, go ahead. Sorry.
No, I was just going to say I can put the link into, where it takes you straight to all the resource options on the website.
That would be great. Thank you. I got another private comment about schools. And yes, you're correct. The fact that kids are, a lot of kids are doing e-learning, and more schools have gotten funding to increase access to internet at their schools. And that's helping a lot too in the communities. And you look at a community, especially in a rural area, and the largest provider or the largest employer is either going to be the healthcare, the hospital, or education, the school. And a lot of libraries also have access to internet. I know libraries have done, several around me have done some expansion of their internet that they have, their Wi-Fi that they have in their building, and so that kids can go and sit in a car in the parking lot, or just sit in the parking lot and have access to Wi-Fi to help complete their homework. So there's lots of efforts going on to increase internet access.
Are there funds for schools to enhance their internet if the infrastructure is old and the equipment is old? Are there
Yes,
funds for schools for that?
Yeah, so there's a specific program. It's often referred to as the E-rate program, but I will put, I'm going to look it up real quick and put it into the chat. It's part of the rural healthcare program through USAC, or the Universal Service Administrative Company, and it's governed through the Federal Communications Commission, or the FCC. And oh, they changed their name. So it is E-rate now on there. So here's the link, and I will show you what that looks like. So it's an application process that they have to go through and put out what let's call an RFP, or request for proposal, for companies to bid on their project. But there's a list of what's eligible for that E-rate program, and it's for both schools and libraries. So you can take.
I'm sorry. How about private schools, Catholic schools, stuff like that?
Yeah, they should be able to apply for it as well.
Okay.
I haven't. I'm assuming that they're eligible. I have not dug into public school versus private school, so that you'd have to do some research on that.
Okay, nothing beats a try but a failure. Thank you.
Yeah, school and library eligibility. Let's see what this says. Elementary or secondary, nonprofit, residential, including public. A private school is probably nonprofit, so I would think that they'd be eligible.
Right, parochial schools are nonprofit. So, thank you.
Yeah. Oh, I had another comment. Yeah, some FQHCs have opened up internet so people can use their internet in the parking lot. That's great to hear too. I hadn't heard that before. Cool. All right, we've got about 5 more minutes left today. Today is really designed just to be an interactive discussion around a specific topic. Carolyn's going to put another link in the chat for a really quick survey. It should take a minute or two to complete. It's just a couple of questions, and that helps us as we create further future topics and resources so that we can best meet your needs. Thank you, Carolyn. Any last questions before we end for today? All right. Well, thank you all for joining us today. We did record today's session, so we will put it out on our YouTube page and on our archived events on our website. Have a great weekend and enjoy the cooler weather outside. Take care.
Thanks. Bye.
Goodbye.